Good evening and welcome to Doctors on Call. I'm Dr. Mary Owen, Associate Dean of Native American Health and Director of the Center for American Indian and Minority Health at the University of Minnesota Medical School. I'm also a family physician for the Fond du Lac Band, and I'm your host for our program tonight on lung problems, influenza, pneumonia, and emphysema. The success of this program is very dependent on you, the viewer, so please call in your questions tonight or send them in ahead of time to our email address, ask@pbsnorth.org. The telephone numbers can be found at the bottom of your screen. Our panelists this evening include Dr. Andrew Thompson, an infectious disease specialist with Aspire St. Luke's, Dr. Jason Wall, a family medicine physician at the Duluth Family Medicine Residency Program, and Dr. Jason Wiederin, a hospitalist with Essentia Health. Our medical students answering the phones tonight are Olivia Hoff from Rushford, Minnesota, Amika Kamath from Rochester, Minnesota, and Jossie Larson from Litchfield, Minnesota. And now on to tonight's program, lung problems, influenza, pneumonia, and emphysema. Welcome, friends. So before we get started with some of the questions that are sent in, one of the things that we talked about at the beginning is that some of you are hospitalists. Can one of you explain what a hospitalist is versus a clinician versus, how about?
Sure, yeah. A hospitalist can be a family medicine or an internist, general practitioner that works primarily in the hospital. They're the person that you might run into if you get admitted to a ICU or a med-surg unit or a regular hospital unit. And
so you take care of any patients who come into the hospital, or?
The scope of practice is pretty broad. And so there are both pediatric and adult hospitalists. And yeah, I think virtually kind of covers the whole gamut of adult and child problems.
And Dr. Wall, you work with residents, so what does that mean for our audience?
Correct. When you graduate medical school, that's sort of partway through your journey, and when you can pick a specialty. You can pick family medicine is 3 years, pediatrics 3 years, internal medicine's 3 years, and then like surgery's 5 or 6 years, depending what specialty and subspecialty. So here in Duluth, we're very fortunate to have a family medicine program that's been around for 50 years now, and we've provided somewhere over 150 doctors to mainly rural Minnesota. And so when people come here, they work with us for 36 intense months, and then they go out and take care of their communities.
And they do everything in the hospital? They work in the ICU, the critical care unit?
I can think of like our colleagues up in Cook, Minnesota. Yeah, they're working the ED, they're working the hospital, they're working the clinic, all in a single day. Yeah.
Very cool. And Dr. Thompson, you told me you work a little bit in the clinic and then also the hospital. So what does that look like?
Yeah, so I'm an infectious disease specialist. So I take care of some patients in the hospital with complicated infections. Then I follow them up in clinic. And I also see maybe difficult or unusual infections that people send to me in clinic.
Who calls you to take care of the patients in the hospital?
These guys.
Okay.
Or many of my colleagues in the hospital.
Okay. So people will consult you.
They'll ask for help.
Yeah.
Yeah.
Very cool. Thanks, you guys. So on to some lung questions, though. Dr. Thompson, I know this is your favorite question. Is it too late to get the flu vaccine?
It is not too late to get the flu vaccine. Now would be a perfect time to get a flu shot. What you want is to get vaccinated at least a couple weeks before flu comes to our community. And flu rates are still very low, so we haven't seen a lot of influenza yet this year, but it'd be good to get vaccinated before you gather with a lot of family over the holidays and before flu comes.
And when's it too late to get one?
Well, there's not really a hard and fast date. We can see influenza all through the winter and even into the spring. Getting one is better than not getting one, but I'd say now. Before Thanksgiving is what I usually tell people.
Okay. Dr. Wall, you want to add something?
Oh, I just had a question. I've heard this, usually with the cold, dry weather, it seems like flu always comes, January, February. But I've heard it always comes like from like the far east and moves, like it hit the West Coast first and then, work its way east. Is there any truth to that?
When I look at maps, I usually see it starting in the south and moving northward. It can vary from year to year. And nobody really knows why it is so seasonal. We think of it as being dry air, but there are places where it's not so dry, and there's more to learn about the seasonality of it.
I'm going to get those guys a lot, but I have one specific question for you, Dr. Thompson, that I just thought of, that someone asked me recently. What do you think of this avian flu that's in the news?
It's
Is that
very
something for us
interesting.
to be worried about?
I would say it's not something for most people to worry about. The interesting thing about it is it has gone from birds to other mammals, including dairy cows and a few humans. And even recently, a few humans that have had no known contact with cows or birds or anything. It could be very serious. At this point, it's not for the human population. So it's something we need to watch closely. Most people shouldn't worry about it.
Okay, thanks for that. Dr. Wall, Paul in Duluth wants to know, is there any advice on best treatment options for pulmonary fibrosis?
I can answer that quickly in that that is a serious disease, and the best recommendation as a primary care, you know, I know a fair amount about a lot, but that's something where you go see one of our colleagues in pulmonology, and because there's specialized tests, evolving treatments, you want to be with a pulmonologist so that you can make sure that they're monitoring the progression of the disease and that they're also keeping you apprised of the latest sort of standard of care and cutting edge treatments for pulmonary fibrosis. I try to advise a lot of people to, you know, sometimes workplace exposures and can lead to pulmonary fibrosis. So, you know, upstream to that, I'm trying to make sure people are, you know, wearing proper, if they're working with silica dust and in certain environments, I'm making sure that they're wearing proper respiratory protection. But if you have the disease, I'd recommend you see a pulmonologist.
So they might come in to see you first, and then you're going to examine them a little bit, see what you think it might be, and then when you find that's out, then you on.
I'd get a CT scan, and then from there, when there's evidence of the pulmonary fibrosis, I would talk to the pulmonologist.
Okay, thank you. Dr. Reeder, anything to add to that?
Well, I would just add, you know, especially if you've got even the start of any kind of chronic lung problem, just doing the basic things like no smoking, avoiding any kind of other sort of inhalants that are going to be toxic to the lungs is just good practice for all that stuff. And anything we can do to improve your basic physiologic function in the lungs is better. Yeah.
All right, I got another one for you. Are there any vaccines available for pneumonia? Who should receive this vaccine? And another common question is, does this mean that you won't get pneumonia once you get that vaccine?
That's it.
Yep.
Yeah. So, good question. The pneumonia in the bacterial sense, there are vaccines, usually based on age and risk factors. And so the primary one that we'd like to vaccinate against is strep pneumonia, and there is a vaccine for that. Pneumonia can be viral pneumonia too, and that's why we talk about influenza, COVID vaccines, things like that, that are going to prevent those other types of pneumonias from developing. So will it prevent, what was the second part of that question? It will.
Dr. Thompson, you can answer this too. Well, if you get the pneumococcal vaccine, does it mean that you will not get strep pneumonia?
It will reduce your risk of getting strep pneumonia. There's other types of pneumonias that you can get, but that is a very common cause of pneumonia. And so your overall risk of getting pneumonia and having problems related to pneumonia is much less.
I'd also point out, if you are vaccinated against strep pneumonia and you get pneumonia, if it's one of the types of strep included in that vaccine, you're likely to be less ill. It might prevent you from being hospitalized. It might prevent you from dying. So it's not perfect. It doesn't prevent all pneumonia, but it may reduce the severity of disease.
Which is really important for people who already have illness, right? Chronic illness like hypertension or diabetes. Right?
Absolutely.
Yep. And
Or particularly for people that have like no spleen, you know. But yeah, I think we used to have, there was the PCV7, then PCV13, PCV20, PCV23. So they've kind of captured up to 23 different subtypes of the pneumonia that they're trying to protect against. So hopefully it'll keep getting better and better.
Yeah.
Yep. And the recommendations sometimes change, so the best thing to do is to ask your doctor. The recommendation is to when to get it, how many to get of any vaccine. So check in. Dr. Thompson, what is mycoplasma pneumonia?
Mycoplasma is kind of a different type of bacteria. It's not like a lot of the bacteria that will cause pneumonia or cause ear infections. It causes what we sometimes call walking pneumonia, because people can be sick but not so sick they can't get out of bed. You might not know it though. It causes cough, it causes fatigue, it can cause other things as well. There has been a lot of mycoplasma or walking pneumonia in the past few months in our community.
Anything to add to that, friends?
Difficult to diagnose. We often will, look at the entire picture and then offer treatment, and you have to use a certain class of antibiotics, and so it's.
Seems to have been a little bit more pneumonia among young people too lately, peds. We've seen that in our clinic.
Yes.
Yeah.
Yep.
Okay. All right. You're not off the hook, Dr. Reeder.
Okay.
How can new moms navigate RSV flu with newborns over the holidays? Actually, anybody can take this one. Maybe our friend in the middle can take this one, Dr. Wall.
Well, we now have the RSV vaccine, and there are some, specific. I can't remember when the exact cutoffs are based on ages. That would be something that your clinic would know. But the RSV vaccine is out there, and it is responsible for a lot more illness and severe illness, much on par with influenza. And so this vaccine's out there, and I really would urge the people at risk, the young and the old, to seek out this vaccine and talk to their clinic about getting it.
Yeah, it doesn't seem to be the same RSV that we used to encounter. It does seem to be making people sicker.
Yeah, and maybe Dr. Thompson, but I know they looked at it. It causes a number of deaths not far off from influenza. And
Oh yeah, we've had a lot of hospitalization. In last year was a big RSV season, so the vaccine, especially for older folks, makes a big difference. And for newborns and infants, it's actually a different type of vaccine. It offers protection through giving an antibody, so is really helpful, especially for premature infants, to help protect them.
Okay, great.
I could just add too that the simple things like washing your hands, hand desanitizers, things like that, frequently throughout the day, especially if you've gone out and come back in, it makes a huge difference in protecting yourself and the people around you. If you're sick, wear a mask when you're around other people, or just stay home if you can. I know it's not possible for everybody, but.
Thanks. Dr. Reeder, what's the difference between COPD and emphysema? Are they the same thing?
I don't really parse out the name like that. I think of it all as a chronic lung problem that's developed over somebody's lifetime, usually as a result of a kind of regular injury to the lung, and in most cases that's due to smoking. And it's something that we can diagnose in the clinic, and what patients often experience is a chronic cough, sometimes occasional phlegm production, and really shortness of breath, especially when moving around. The best thing you can do if you're worried about emphysema or COPD is to stop smoking, or try to improve your environment if it's secondhand smoke that's doing that to you. So.
Okay. Speaking of smoking, Dr. Wall, this is a call from Ashland. The caller knows someone who has bronchitis and rhinovirus. Are both of these conditions related to the lungs?
Yes, bronchitis is a chronic, usually associated with smoking, can certainly be associated with allergies or other environmental irritants, but the bronchioles, the larger airways of the lungs, become chronically inflamed, leads to a lot of mucus production, chronic cough, and chest discomfort. And then rhinovirus, rhino meaning nose, is one of the common viruses that causes common cold, upper respiratory tract infection type symptoms, and can certainly affect both the upper and lower airways as well.
Okay. Anything to add, Dr. Thompson?
No, just that we can put a name to a lot of these viruses now that we didn't really know before because we have more sophisticated testing. Some of these nasal swabs can really identify, is it mycoplasma? Is it rhinovirus?
Mm-hmm.
So we have these words out there that we didn't have a name for before.
Mm-hmm. Okay, great. This is a good one. And I'll let anybody take this one. I'm a senior who has COPD, and I recently got my COVID shot and had a reaction for 4 days. I'm wondering if this is normal, and should I continue getting this shot?
As far as vaccines go, they all come with a risk of side effects, and that's just your body kind of recognizing that it's an antigen, that it's got to rev up your immune system and get ready, so that when it does actually see that virus, it's able to respond in kind and prevent you from getting very ill from it. As to the specific point of should he get this vaccine again, I'd say talk to your regular doctor so that they can get a full picture of everything that you went through and what you experienced, and they can make a solid recommendation as to if you should get that one or not. But just broadly speaking, vaccines are safe. They all have some side effects that people tolerate on different levels, but they are safe and helpful.
And the data to support the efficacy of the COVID vaccine is pretty unequivocal as far as if you take a group of people that get the vaccine and that don't, and they get COVID, you know, there are going to be a lot more deaths in the unvaccinated group.
And it's a highly tested vaccine as well. All right, Dr. Thompson, do you build up any immunity to infectious diseases over time without vaccines?
Yes, you build up immunity to infections after having the infection. Vaccines give you that protection without having the infection. It's better to never get measles and have had the vaccine than to get measles and risk all the potential complications of that, from death to brain damage. So I'd rather build my immunity without getting sick if I can.
And there's also the problem with we are contributing to spread throughout our community when we don't get vaccinated. So it's not just about ourselves, right?
Right. It's not just about the individual. It's about the community as well.
Okay. Thank you. All right. Dr. Weeder, what's the difference between flu and pneumonia? We talked about this a little bit.
Sure. Pneumonia refers to an infection in the lungs. Flu would be a specific type of virus that can cause an infection in the lung. You can get pneumonia from either viruses like influenza or COVID, but you can also get pneumonia from bacterial organisms like strep pneumonia and things like that.
All right. We have no more questions from our audience, so let's ask each other some questions. What do you see the most of in your office?
The most of. I see complicated infections, and there's a really broad spectrum of that. Sometimes it's artificial joints that get infected. Sometimes it is bone infections. Sometimes it's heart valve infections. I can't say there's one thing.
Mm-hmm. Dr. Walls?
Preparing for this show, I wanted to sort of put out there to anybody in the audience who might have COPD, which stands for chronic obstructive pulmonary disease, that there are some new guidelines that have been out that recommend perhaps the medications that are now recommended. There's less of an emphasis on taking inhaled corticosteroids and more of an emphasis on taking this class of medications called long-acting muscarinic agonists. So I would encourage people to go meet with your doctor and make sure that your medication regimen is optimized.
Thanks, Dr. Walls. That's great. Dr. Weeder, what would you like to tell the audience?
Yeah, something I was thinking about just in preparation of this is just how much really severe disease we see in the hospital, and how a lot of that is from other complicating factors like chronic lung disease with emphysema, COPD, and how these viruses and bacterias, you know, while one person can do really well and survive and get over certain infections pretty easily, other people with these other problems, and then broaden that to diabetes and other chronic kidney disease, things like that, you're just at such a higher risk for developing more severe disease and ending up in the hospital and having a much higher risk of both debility and then, worst risk would be death. And so I think that's why it's so important that we always talk about these things every cough and cold season, to talk about getting vaccinated, reminding everybody to wash their hands, and then doing the best you can for your health by taking care of your chronic problems, seeing your regular doctor with some frequency, and trying to talk through what sort of lifestyle modifications we can all make so that the people around us, the people that are fragile, don't end up sicker than they are.
Sorry, I had...
No, you're a teacher. Go ahead, Dr. Wall.
One other was that for people that have smoked or are currently smoking, in case the audience wasn't aware, we offer lung cancer screening now. And it's actually been, the age for screening starts at 50 now. So if you're 50 and you smoke or have ever smoked, talk to your doctor about low dose. There's a certain CT X-ray scanning protocol that they use to look for lung cancer.
Thank you, Dr. Walls. That's an excellent reminder. Is there any, Dr. Thompson, you've got off for a second there. Is there any treatment for long-haul COVID and associated symptoms?
Oh, that's a great question. Because we had a novel infection, a new infection that affected many, many millions of people, we're seeing new complications from that. Now, long COVID is a little hard to define, and we're still working on trying to come up with a clear definition of it. But it's basically lingering symptoms after having a COVID infection that aren't due to something else. There's some other infections that may be similar, may cause similar lingering symptoms. But really what helps with a lot of things is consistent rehabilitation. So working on improving stamina, improving lung function. We don't have any particular drug treatments or other treatments, but it's really rehabilitation that's key.
How do you know when someone has long COVID? Because it's such a, anybody.
First of all, we have to establish that they had COVID. You can't get long COVID if you've never had COVID, so we have to establish that by history and maybe by testing, and then try to correlate their symptoms with the timing of the infection. But it's not easy.
Are you seeing this much in clinic with people concerned, Dr. Wall or Dr. Reeder?
Well, I think the times that I've seen it, and in addition to my hospitalist work, I also round in some of the nursing facilities around the Twin Ports, and I do think that to some extent, they've identified that it's contributed to cognitive impairment, and in the nursing home, we already have a number of people who have cognitive impairment, and I often wonder if that's contributed in some way to those changes in some of our patients that we see there.
Dr. Wall, you look like you were going to add something.
Oh no, I was just going to defer. I think we'll see some recommendations come out in the coming years about some general criteria for diagnosing and some general treatment guidelines. And right now, I think, Andrew, I don't think there are any clear recommendations as far as how to treat it, other than just taking a comprehensive approach of, good sleep, exercise, and then just wherever there might be a deficit, working on trying to address that through therapy.
And prevent reinfection with COVID.
Yeah.
Dr. Thompson, since we have your infectious disease, anything else that you really want to emphasize as far as vaccines tonight?
No, I was actually going to add regarding the earlier caller who said they got significant side effects from the COVID vaccine. I do too. Like, I get significant side effects the day after, maybe even another day after I get the vaccine. But that's your immune system proving that it's working. It's activating. It's recognizing this new pathogen. And other vaccines can do that as well. You're not getting sick. You're not getting the flu from the flu vaccine. It's your immune system showing that it works. There's some data, it's not that strong, that you might have better protection if you got side effects from the vaccine. Not that you don't if you didn't get a bad reaction, but that's what vaccines are designed to do.
If you're healthier, do you tend to get a stronger response?
I don't know that there's a clear correlation.
Okay, I've heard some people with that. One last question I'm going to ask you. Is the RSV vaccine one and done, or should you get it annually, Dr. Wall?
I should know that,
Dr. Thompson.
but I'm pretty sure it's meant to be every year. Yeah.
Okay.
I think it's one and done.
Okay.
Thanks.
For now, we'll know
Okay.
more.
Yeah. It's a newer it's relatively
It's
newer
it's brand
vaccine,
new.
and so yeah.
Well, then they're figuring out how long it actually lasts.
Exactly.
Though.
That's
yeah,
okay.
yeah.
Yeah.
All right. Thanks, y'all.
Yeah.
I want to thank our panelists, Dr. Andrew Thompson, Dr. Jason Wall, and Dr. Jason Wiederin, and our medical student volunteers, Olivia Hoff, Amika Kamath, and Jossie Larson. Thanksgiving is next week, so it'll not be a show, but we'll be back on December 5th. Thank you for watching, and good night.